Hello, everybody. Welcome to today's Tech Talk. Thanks for joining us. This is our 30th birthday today, and it's another opportunity for us to bring you the latest digital transformation info for the care sectors. I'm Janine Bennett. I'm the Assistant Secretary and Engagement Lead for the Department's Digital Transformation Program, and I'll be your moderator for today's webinar. It's great to see you all here again. Today, I'm joining you from Canberra on the lands of the Ngunnawal and the Ngambri people. I want to acknowledge those traditional custodians of this beautiful land I live on and pay my respects to elders past, present and emerging. I also want to extend that respect to any Aboriginal and Torres Strait Islanders we have in the room today. Thank you for joining us. It's great to have you here. A couple of quick housekeeping notes before we get started. As always, if you have connection issues throughout the session, there are dial-in details. They're on the screen right now. They're also in your meeting invite. You can use those to get back in if you have any issues. As usual, today's webinar will be recorded. We'll upload that recording to our website soon after today's session, so you can watch it again or you can share the recording with anyone else who might have interest in this content. You can also watch any of our previous Tech Talks on the website as well. The links that we share with you today will be available using QR codes on the slides, but we have already also posted those links in the chat. So we know a bunch of you don't like the QR codes and would prefer to just have the links. If you want to access those, you can just go to the chat space in Teams and you'll be able to see all of those links. We'll also email them out after the meeting, so you'll have nice, easy access to those links if you want to refer to them in the future. Just note though, our chat function is turned off from the beginning of the meeting. That's so we keep the Q&A panel open, so all of your questions can be directed through the Q&A panel. And speaking of Q&A, we have about 30 minutes at the end of today's webinar set aside for your questions. The Q&A tab is open for business, so you can type your questions in at any time throughout the session. You'll find the Q&A tab at the top of your Teams window. Remember, if you see other people's questions that you like the look of and you're interested in, just go ahead and vote those up. Unfortunately, we don't always get time to answer every question. If we don't get to your question in session, we will take those on notice. We saw a comment to that effect in our last Tech Talk, which I actually missed at the end of the session. So that was on me as the moderator. But it was around one of the questions that had been quite heavily voted up, but it was a question that we knew we couldn't answer in the room. So we did take that one on notice. So just know we're not ignoring questions. If we have subject matter experts in the room, we will prioritise the answers we can give you today, and the others we'll try and acknowledge, but may need to take on notice. All right. Just one point of order in terms of the work that we cover in this Tech Talk. It's really predominantly about our technology and digital delivery work. We do our best to answer questions that are more general and maybe have a policy bent to them. And we do have a number of subject matter experts from the policy areas here today. So where we can, we will touch on those questions, but we will prioritise the questions that are around the digital agenda. Before we get to the agenda, I do also just want to take a minute to welcome our media representatives who are joining us today. We appreciate your continued interest in this really important transformation work happening across aged care and the care sectors more generally. If you do have any media related questions, please do direct those to our media and events team. You can simply email news@health.gov.au and they'll be in a position to help you with those media related questions. Okay, here at Tech Talk, we make every effort to ensure that the info we provide is accurate, relevant and informative, but it's not our intention to provide specific advice for individual circumstances or to make government commitments in this room. Those happen elsewhere. The information that we include in the Tech Talks is covered in the interests of sharing our common experiences and collectively maturing our sector as we go about identifying and tackling those common challenges that we all have. But it really is up to each individual and organisation to exercise their own judgment and skill about what is needed in their individual case and how you would apply the information that we share and whether or not it's useful to your particular circumstance. So we just encourage you to use that lens as you're listening today. Onto the agenda. Today, we first up have Faye Flavaris, who's going to talk us through the regular digital transformation update. Faye will focus on the roadmap and some of the new and updated resources that we have released from the department. Then we'll be joined by Michelle and Annette, who are going to talk to us about business to government, including the new client management API suite. From there, we'll have a quick learning bite about AI, and then we have Shahara and Apira here with us with updates on the government provider management system and places to people. Then Faye comes back, will be talking to us about a digital future segment on innovation, and then we'll close out the session with our usual Q&A. That's our agenda. We've got some first-time Tech Talk presenters in the mix with us today, so welcome to those folks. It's great to have you with us. And on that note, I'll hand over to Faye, who is our Chief Digital Information Officer here at the Department of Health, Disability and Ageing. Faye's responsible for driving the department's digital agenda. Faye, over to you. Welcome.
Thanks, Janine, and hello, everyone. Good to have you all with us again. Like all good digital transformations, this is an ongoing and continuing journey. So let's jump straight into it. I'll start off by giving you guys the regular state of play on our roadmap. As always, it comes with a disclaimer. It's important to note that this timeline is there to support the aged care reform agenda and our ongoing releases, but it should not be considered an official commitment from government that happens elsewhere through processes outside of these tech talks. As you have probably heard at these sessions previously, we make a point of sharing this roadmap early and often. When changes occur, we do call our intent here of those changes so you can see them. And that said, time to look at our major releases for this half of the year in 2026. So we already had a February release in My Aged Care. That release focused on streamlining provider pricing updates against multiple outlets, so providers don't have to re-enter the same information for every outlet across its pricing cycle. So hopefully that helped reduce some of the administration. We've done some improvements to the transition process for HCP clients entering support at home. And those improvements included additional information on the support at home letters, such as the assistive technology and the home modifications, high tier cap and remote supplements. It also included automating the management of restorative care pathway caps and also automated the notice of decision letters for the CHSP assessments. In that release, we also had business to government gateway updates. That included the very first client beta APIs, which are currently available in our business to government gateway, or beta G as we affectionately call it, developer portal for early integration. These are read-only client APIs, which will allow providers through their software to receive key client information from our My Aged Care service and support portal after a referral is accepted. So we're hoping that will definitely assist assessors and providers to stop any duplication in data entry between the My Aged Care Gateway and their own systems. So I look forward to hearing some feedback around our client beta APIs. For this weekend coming, we have GPMS release. These changes will focus on preparation for care minutes performance-based supplements, which will come into effect in April and will link the amount of funding residential providers receive with the actual care minutes that they're providing. So this allows providers to self-manage also offline beds using the Manage My Organisation tile in the registered provider portal. So that's another change going in. The weekend's release will also enable residential aged care providers to preview existing and future finance and operations information on the portal. And there's also some updates to the star rating system to include graded assessments against the strengthened aged care quality standards within the compliance rating section, consistent with the requirements of the new Aged Care Act. So as you can see, we were staging some of these changes and, dropping in more automation as we go. We do also have a release in June for GPMS, which will introduce DocuSign capabilities for the provider operations collection forms. It will have updating to the quarterly financial reporting for residential aged care by adding new data items and removing some of the older ones. And it will also include the displaying of quality standards, conformance outcomes on the My Aged Care website. So that's the GPMS release in June. And then there's also going to be a release in June for the My Aged Care and B2Gs. So in the My Aged Care, we're facilitating the introduction of the support at home pricing caps, enabling providers to enter pricing that aligns with those caps. So, starting to iterate on some of this stuff and ensuring Services Australia can validate claims against these limits. So we've got that integration connection piece there. We're strengthening assessment workflows and making updates, allowing providers to see clear decision information for more accurate service planning, and enhance the client communication letters and supplying you guys with some better data analytics. And on the business to government gateway side of things, the client APIs will actually go into production in June. So they will be live. So giving, providers and software providers a good sort of 4 to 5 months to look at these beta APIs that we've already put out in February and see how you guys can best integrate that into your own environments to help with the administration reduction in that sense. All of these will be supported by the intermediate and advanced conformance profiles delivered in partnership with us by the Australian Digital Health Agency. You'll notice that we also have now started including the release information for Services Australia. So hopefully this gives you a one place to look at what's going live for aged care. In addition to their business as usual updates and quarterly reset of support at home budgets, there are 2 other release items in April to June period that for Services Australia, and they will commence paying the new Care Minute supplement to eligible residential care homes in metropolitan areas from the 1st of May. So there's a change date there, and the eligibility will be determined by the Department of Health's or the departments and communicated electronically to Services Australia. The Care Minute supplement will automatically be paid as part of the monthly claim process that you're already going through, provided by the department, and the amount of base care tariff will be reduced and replaced with the Care Minute supplement. So small ongoing incremental changes, as you can see, folks, but we're really trying to communicate, what's changing and when. There'll also be homes with specialised homeless funding status, and those in regional, rural and remote areas, they will not be impacted. And the Care Minute supplement will be included in the payment statement as well for your information. Further information will be added to the existing supplement eligibility screen in the aged care provider portal as well. So just closing the loop on that information. So the item that's also titled Services Australia Entry and Exit API relates to changes that are being made to improve the transmission of this entry and exit information between My Aged Care and Services Australia, where an entry and exit notification cannot be processed by My Aged Care, a manual remediation is required. So receipt of those notifications are critical for the proper functioning of the department systems, which include determining whether a care recipient requires an initial residential funding classification assessment, allows the approved provider to request a reclassification or a reconsideration of a care recipient's classification, and the estimating care minute requirements for a residential and aged care facility. It also has other functions such as assessing providers' performance on quality measures and staffing. It's going to generate reports and dashboards for the number of deceased clients or clients currently in care. So you can see still quite a lot going on, folks. We're also still working with the Commission to get their release onto our roadmap. We'll keep you posted on that. So hopefully that summarises the roadmap. And so let's go through some of the resources and updates that we've got for you as well. Like to clarify some of the differences on the quality indicator program. The slides talk about the differences between the registered provider portal and the approved provider portal. So we know there are a number of portals, and that can be a little bit confusing. But briefly, under the Act in 2024, all of the quality indicator program reporting should be done in GPMS's registered provider portal. So you can see the date range there. This change occurred from Q4 financial year 25-26 onwards. Then, to view any historical quality indicator program data submissions from Q1 into the financial year 25-26 or earlier, which is all of that data that was submitted in the Aged Care Act for 1997, so the previous act, please refer to the GPMS approved provider portal. So essentially in the Act we cut over, so providers can continue to edit their quality indicator program data submitted for the current and previous reporting period using that registered provider portal. So hopefully that has all made sense. This info and additional details about the differences between the portals is on the slide, and it's also on the health website. Of course, you can access it on the web and using the QR codes. And as Janine said, we've dropped the links for those who prefer that. So moving on to a few more updates. The department is currently working with the University of Queensland and the National Ageing Research Institute to conduct a data and reporting review. We collect a lot of data from you guys, and we want to hear from you all, especially the residential aged care providers, the in-home care providers, and the software development community on how to improve that and how do we, synthesize it and make it a little bit easier to collect, specifically around clinical reporting and care needs, care quality, and care delivery reporting. So there are 2 online forums still available for you guys to, register for. So that we've separated them in residential aged care providers and software providers on the 24th and 25th of March, respectively. You can also complete the online survey if you want by the 30th of March, so giving you lots of different channels to provide feedback. And that will help us to understand and improve how we collect data and how we use it. And so hopefully we can come up with a more holistic and baseline set of data that we can use across many different policy areas rather than collecting different bits of data for different areas. Moving on to stage 3 changes to the reporting requirements for CHSP providers. These will be introduced in the data exchange later in the year. These are the new resources that are available to prepare you for the changes. The staging environment and technical specifications, including guidance for your organisations submitting data through the system-to-system transfers and the bulk uploads, are available. You can see them here. And providers with access to DEX staging environments can preview the stage 3 changes now on their test sites using their usual logon and details. So we'll share some more information in the mid-year around those stage 3 releases. So hopefully this is a good start for you guys to have a look at, and please come back with questions if you have any. Also, a couple more things. Late last year, we asked your thoughts on the changes to the Aged Care Act and all the changes we did in the 1st of November. Since then, we have received more than 2,000 responses from older people, families and carers and how aged care can be improved. And these are the results. I'd encourage you to have a look at them. And then finally, the last bit of resource that I think is good for you all to know. We've had a frequently asked questions document for Care Minutes supplement created. This resource provides answers to questions about Care Minute supplements being introduced from April 2026 for non-specialised metropolitan residential care homes. Well, that was a lot, and that's it for me now. I'll be back with a bit of a learning segment a little bit later on. But in the meantime, I'd like to introduce Annette and Michelle, who are joining us. They're not the first time, they're coming back to talk to us about the Business to Government Gateway update. So I'll hand over to Michelle and to Annette. Over to you guys.
Yeah, thanks, Faye. So my name is Annette Radosavovich, and I'm the Acting Director from the Reform Implementation Division. And I'm pleased to be joined by Michelle, the Director from the Digital Transformation and Delivery Division. Together, we'll be providing an overview of the Business to Government, or B2G, and sharing an exciting update on the release of the new client APIs. By way of introduction, B2G is an initiative addressing recommendations from the Royal Commission into aged care and safety. It aims to simplify how aged care providers report to government by enabling direct system-to-system connections. We're making it easier for aged care providers to interact with government by connecting their systems directly using secure digital tools called APIs, Application Programming Interfaces. These tools help share data more reliably and quickly, reducing the need for manual entry and cutting down on duplication. Ultimately, a better connected aged care system helps spend less time on paperwork and more time delivering high quality care to older Australians. B2G is continuing to grow its API service offering, focusing on those that provide the greatest value to the aged care sector. This slide shows the steps we've taken to identify the next APIs that deliver the most benefit to providers and software vendors. Each stage builds on feedback and collaboration with stakeholders. Our goal throughout has been to reduce complexity and ease the administrative burden felt by providers so staff can spend more time on direct care. To identify the next APIs, we followed a clear 4-step process shaped by sector feedback and practical insights. We conducted a sector-wide survey attracting responses from residential aged care providers, in-home care providers, and software vendors. This helped us confirm where administrative burden is highest, where processes remain manual, and where APIs would create the greatest efficiency and accuracy gains across the system. We then undertook a series of human-centered design workshops with volunteer providers and software developers. These sessions allowed us to test real-world workflows, validate the survey findings, and understand what providers and vendors needed for a smooth, practical integration. Using this evidence, we worked with our technology teams to assess feasibility, alignment with existing B2G patterns, and the potential benefits to the sector. This ensured we progressed APIs that are stable, scalable, and directly responsive to sector needs. We're now in the implementation phase focused on engagement and readiness. This includes co-designing and documenting APIs with providers and developers, releasing specifications early so the sector can begin planning and integration work ahead of formal adoption. This approach supports smoother onboarding for vendors, clearer guidance for providers, and ensures upcoming APIs are well understood and practical to implement. I'm now going to hand over to Michelle.
Thank you, Annette. Today, we are now excited to announce the release of the client APIs. This represents a significant step towards simplifying operations for providers and strengthening digital interoperability across the aged care system. To support early planning and smooth integration, we released beta versions of our APIs ahead of production. In February, we released early versions of the client APIs, giving developers an opportunity to explore the functionality, begin integration, and provide feedback before the final release in June. The client APIs will enable access to key client information, including client management details, referral management details, support plans details, and assessment details. The client management beta API encompasses identifying and demographic information. The API will expose the following information, including basic details, which is name, date of birth, gender, contact information, and supporters, For demographics, we've got cultural and personal context, for example, country of birth, language needs, ethnicity, and marital status. For our referral management beta API, this provides referral information that supports entry into care, including funding program, for example, support at home and residential care, as well as service type, subtype, package level, and referral comments. For our support plans beta API, this shares a summary of assessed care needs and goals, including identified concerns, client goals, and service recommendations. This also includes approved services and funding details. For our assessment beta API, this provides visibility of the assessment process, including assessment outlet name and assessment completion date. So by connecting these systems more smoothly, these read-only APIs help both providers and vendors in several ways post-referral acceptance. Maybe to the next slide, please. We have faster client onboarding, allowing access to essential client information to begin service planning. We have less manual data entry, reducing time spent copying information from My Aged Care into your system. More accurate and consistent information with fewer errors and duplicated details across platforms. And then there's better support for care planning with the right information available to you at the right time. For providers, this means reduced time spent on administration with faster access and more accurate client information, ultimately meaning more time being able to be spent on direct care to older Australians. To reduce friction around the onboarding of software vendors and their products, the B2G platform will provide early access to API specifications, enabling you to plan and build ahead of provider demand. Improve data workflows, reducing reliance on manual data exchange and streamline onboarding journeys. There's consistency with other B2G APIs, aligning patterns, structures, and documentation. And then we have clear integration guidance with developer resources published on the B2G developer portal. Overall, supporting smoother provider workflows and reducing the complexity around integration. I'll hand back over to Annette. Thank you.
Yeah, thanks, Michelle. So next week, we'll be running co-design sessions with providers and software developers to help validate the new client management APIs. These sessions will assess sector readiness, identify integration challenges, and gather actionable feedback to refine the API and supporting documentation ahead of the planned production release in June. For providers, this will include gathering their insights on how to clearly communicate API benefits, understand their readiness and barriers to adoption, and identify the guidance and support they need to confidently move forward implementing APIs. For developers, this will include gathering detailed developer feedback across all API domains to ensure they are fit for purpose, easy to integrate, clearly documented, and capable of supporting efficient client referral, care plan, and assessment workflows. Next slide, please. The B2G team have various avenues of support in place for developers and providers, including resources available on our webpage and support via email for our software vendors, which you can visit by scanning the QR codes on the screen. And we would just like to thank everyone for their time today. Thanks, Faye.
Thanks, Michelle. Thanks, Annette. Really appreciate that. So everyone get up there and have a look who's interested. The client APIs, they're a long-awaited asset. I think that we've been looking to provide the ability for people to access information from us in government and draw it out to you guys in real time as read-only. Maybe once we get over this hurdle in the future, maybe you guys can update it back to us as well, but let's not get ahead of ourselves. So thanks very much, folks. All right, we're now moving on to a bit of an artificial intelligence learning bite. So we introduced this new series last Tech Talk, and we thought that we would start looking at strategic information from a digital perspective to help uplift the maturity more broadly across our sector. And so this month we're looking at artificial intelligence and the concept of hallucinations. So let's give us a little bit of a definition of what that means. As we talked in the last Tech Talk, AI holds a really big promise of being able to assist us speed up our work, maybe more effectively, maybe more efficiently. But we have to approach the use of AI with care. So you may be following the discussion about the accuracy of some AI outputs. You may also have seen the disclaimers that many of the AI-generated contents indicating that the information may not always be complete or fully accurate. So it's really important reminder that AI tools are designed to support human decision-making at this stage and not replace it. And the way AIs work, it uses the information at hand and kind of can be used to help predict things. So the quality of AI outputs really depends on the data that it's using or you've given it to train the models and the way those tools are applying that in practice. And how you apply it in practice has a lot to do with the questions you ask of it as well. So as AI adoption grows, there are a number of issues that are being more clearly identified across different sectors. And these include outputs that may be inaccurate, may reflect unintended biases. It might even raise privacy concerns depending on the data that you give it, or it might provide advice that is not appropriate without a human review or just actually plain wrong. So to illustrate why this matters, here's a practical example of how relying on AI output without adequate review can lead to unintended consequences. So in January, a media report described how an AI-generated article on a travel booking website directed visitors to a remote location in Tasmania's northeast in search of hot springs. Sounds great, right? Nope, because the organisation involved acknowledged that they used an AI tool to generate the promotional content that they put up there and that the tool had produced inaccurate information. So according to the report, the website described the location as a peaceful escape and it listed it amongst the best hot spring experiences for the year, complete with images of people walking alongside the springs. The only problem is that in reality, no such hot springs actually existed. They were entirely fictional. So this is an example of someone actually using AI to help come up with some, advertisement material, didn't actually read what they put on it, and then put it out there. It sounded really convincing and ultimately very untrue. So the incident serves as a useful reminder, albeit a very basic one, of the consequences of unchecked AI outputs. So encouragingly, these issues are increasingly becoming well understood and improvements are being made through better design and governance and oversight of some of the artifacts that come out. But a key strength of the responsible use of AI is making sure that people stay in the loop and engaged. It's not enough just to take a piece of output and then start using it. They actually need to kind of look at it, identify any errors, apply some clear judgment and correct any accuracies. So with the right training and settings, and AI systems can also be designed to reinforce the importance of human intervention, professional expertise, and accountability. Because ultimately, even if you want to get a little bit more mature with AI and create virtual agents or bots or whatever you want to call them, someone needs to be accountable for the work they do. So when used responsibly with clear safeguards and strong human oversight, AI can be a powerful tool to enhance services, support staff in their work, and improve outcomes while maintaining trust, safety, and accountability. So we thought, how can we counteract hallucinations? With the human oversight and checking one way is one way, but this happens after the content's been generated. What can be done to instruct your AI tool to find and direct you to the most accurate and relevant content in the first place? So we thought we'd do a little bit of a practical example on how this, to illustrate how this might be done. So you've told us that there's a lot of information on our website, and the answers you need might be in a PDF file, on a web page, or in a different location, which is not very obvious. So that can make finding some of the information that we're giving you a bit time consuming, especially when you don't know exactly where to look. We've also been giving you lots of information over the last 6 to 12 months. So you want to get to the most up-to-date information, because we gave you early versions of something and then we came back and gave you updates on that. So to try and stay impartial, so I won't list any AI particular tool. I'm asking you to, get in, and I'm sure you can think of whatever tool you want, and run this quick little exercise. Open your approved favorite AI assistant. Feel free to do this in real time with us. Ask it the question you see on the screen here today on the slide, and you can copy the prompt from the chat panel if you're following along, because I've got the team to put it in, and let's see what it comes up with. So we've tried this one on our own system, and the tool will scan the entire site content. I'm probably asking for trouble now. I'm going to probably just crash my website, but that's all right. I hope not. Fingers crossed if you all do it at the same time. And it has access to it because it's public facing, including information around the PDFs and the documents, and it can summarize the results for you. So make sure you include type your question here, make it specific, because you don't want the results to come back on the whole site. And you can usually tell it to return the text exactly as written, or you might decide to say summarize it in themes or whatever you want. The more specific the prompt, the better the result you're going to get. And if you're doing this at home, hopefully you've started to see some of the results come back to you. Importantly, now, here's the thing, it's time to check the results. So I gave you a lot of information. You asked the tool to find the actual references, including the page numbers of whatever the question you were asking for. So you can check the actual resources yourself and make your own judgment of whether it provided you the right answer back. So make sure the info provided is in the right context, and then you realize maybe I didn't ask the question quite the right way and you might want to adjust the question. But using AI and making sure you do that important final check shortens your research time, but also gives you the confidence that you can rely on the results and starts to kind of flex that digital savviness and skill that I think we're all going to need in the future as we head into what I think is going to be a fundamental paradigm shift as we start to use AI more and more in our daily lives, not just at work. So on this side, if I go to the next page, on the slide, it asks, where can I find additional fields on meal delivery for DEX reporting? Notice that the tool we used provided the link to the actual resource because that was the results. This is an example of what we asked. So we can go straight to the source to check the answer. We use the AI to speed up the search. So it was very quick, but always ensure the human makes sure the logic checks out for the question you're asking. It is worth experimenting with, folks. You can add some timeframes into your question. So ask for the latest, the most current version of the resource rather than it comes back with something that might be 12 months old. The tech is new and it's important that we get comfortable with it, us understanding its strengths and its limitations and have a little bit of fun with it. So that was our learning bite for today. Hopefully you found that little experiment useful and you might have followed along at home, but if not, you can do it at a later stage. We'd love to hear from you if there's any other little learning bites that you would like to know about. Excellent. So I'm now pleased to welcome Shahara, who will give you an update on GPMS, and Apera talking us through the Places to People update. Thank you for joining us today, folks. Over to you guys.
Thanks, Faye. Hi, everyone. I'm Shahara, and I'd like to give you an overview of what's coming up next in the GPMS release and what providers will be able to perform in each of the GPMS portal from the 23rd of March. So the registered provider portal will be enhanced to allow providers the ability to submit and edit registered provider reporting, including the ability for providers to view star ratings and including the metrics used to calculate the ratings, ability to view compliance information, including performance against strengthened aged care quality standards and regulatory decisions and star ratings, the ability for providers to preview financial operations before it's published for the next period within the registered provider portal, and the ability for providers to view and manage their residential aged care offline beds records. The registered provider portal currently already has the functionality to view and submit 24/7 RN reports, quarterly financial reports, and the quality indicator program data. In the approved provider portal, it will continue to be available with historic information about the approved provider entity as it existed under the Aged Care Act 1997, including the QI program data, QFR, and provider operations. I just want everyone to note, in preparation for this release that's coming up, there will be a scheduled maintenance period where providers will be unable to access the system, and this will occur from 11:15 on Thursday, 19 March to 8 a.m. Monday, 23rd March. Following this March release, GPMS will continue to be enhanced over time, with the next system update occurring in June 2026. Can we go on to the next slide, please? Now, this slide contains details of provider communications and publications that we are planning to complete between now and the system released. In the beginning of the month, we also provided a similar GPMS update at Sector Partners Forum and at the Digital Data Reference Group. And so the update is in relation to all the publications that we'll be making. And this week and last week, we emailed providers using the GPMS schedule, advising providers of the GPMS schedule maintenance period and detail on the upcoming release. This email will also be supported by a separate Yahoo article. And then on the 23rd of March, and the updated system will be available. We'll email providers advising them that the release has occurred and the information on where to find GPMS resources. On the 23rd of March, all the updated guidelines will also be available in the GPMS resources page. And the list of resources that will be available is on the right-hand side of the screen, you're looking at right now. So the key updates to these documents will include the functionality that I mentioned in the slide before and the enhanced user roles as well that'll be outlined in the guidelines. Can we have a look at the next slide, please? Now, this one is a slide that we always show about where to go for support. So you can go to the My Aged Care Service Provider and Assessor hotline. You can go to the GPMS website and also contact the GPMS project's email address for any general inquiries. You can call Services Australia on that number that's available, as well as go to the Commission for any questions relating to change in circumstances, information, or the smart form. Now I'll stop for a second. Now I'll throw over to Apera, the Director of Contributions and Accommodation Reform Branch, who will share information about their Places to People changes.
Thanks, Shahara. Hi, everyone. As Shahara mentioned, Apera Po, I'm from the Dementia Diversity and Residential Care Division. The following 3 slides are going to be a recap on the Places to People reform, some GPMS updates that we are looking for over the that'll be effective from the 23rd of March, and also just about offline bed reporting. So, following the commencement of the new Aged Care Act 2024, and from the 1st November 2025, changes were undertaken to the residential system known as the Places to People reform. That means residential places are now allocated to an older person instead of an approved provider. This new reform replaced the former aged care approvals round and bed ready process that previously allocated residential places to providers. And from this new reform, there were 2 main aspects. So one aspect was for older people. This new system aims to be person-centered and gives more choice and control over who provides their care. when an older person is allocated a residential care place, they can take their place to their chosen provider. The other aspect is for providers. This new system means that they have more flexibility and autonomy to decide how they approach the market, and providers can make decisions about their service expansions when it suits their organisations. Thank you. So, with the GPMS system changes, under the new provider registration model, the Commission shares information to the department in GPMS about how many beds have been approved as part of the residential care homes approval. GPMS holds data about the total number of beds and the number of offline beds at a service. Under the new aged care rules, providers are now required to notify the Commission when beds are offline and not available for use. An offline bed is one that is temporarily not being offered to older people or at a residential care home. For modified Monash, or known as MM, 1 to 5 regions, they are required to notify when beds will be offline for 3 months or longer, and for MM 6 and 7 regions, if they have beds offline for any period of time. Since November, providers have been able to view their total beds and offline beds at an approved residential care home through GPMS in the Manage Your Organisation tile. If providers have had changes to their residential beds, they have contacted their local network office with the details of their beds being taken offline, and then the department has updated the data on the provider behalf in GPMS. The new functionality from the 23rd of March in this release will allow providers will be able to self-report their own offline beds. Next slide, please. Yep, thank you. So with offline beds, as I mentioned before, and under the Aged Care Rules 2025, providers are required to report their offline beds. And so following GPMS Release 13, providers will have the capability to self-report their offline beds again under the Manage Your Organisation tile within the GPMS portal. As mentioned in the previous slide, up until now, the local network has been assisting providers to report offline beds. This new functionality will allow providers to self-report and manage their own data. Guidance and support in completing this process will be available through a range of resources, and the local network will still be able to continue to support you if required. It is important to note that providers will not be able to claim for subsidies for your residential care home if all the beds are reported as offline. You'll need to bring your beds back online to begin claiming subsidies. Thanks, everyone. I think I'll hand over to you, Faye.
Thank you. Sorry, just trying to get off mute. Excellent. Thanks for that update, folks. Okay, next up on the agenda is we'll see you both at Q&A shortly, Shahara and Apera. We're now going to continue with our new Digital Future series, and today's topic is about innovation. So it's a word we hear a lot, but what does it actually mean? For me, it's not a buzzword. Innovation is a doing word. And it only matters when we put it in place rather than talk about it. And it's not a one-off breakthrough. So this is, it's not like this big grand thing or event that we innovated. It is actually that I think is really important, that it's a muscle that we use every day, and it's a mindset that we give to our people. Now, and you go, well, how do I put this into practice? And I think there's two flavors of innovation. There's the bottom up, the day-to-day improvements that streamline processes, remove friction from our everyday tasks, whether that be manually. And then if you've got it right, then you look for opportunities to automate just to make work easier. And then there's the top down, where we can be a little bit more strategic in the shift and the challenge on how we want to operate and redesign the whole experience, making it, for some, you might want to say digital first, but that can be quite confronting. And it's about how does that digital help redefine how you might want to do something, making sure that the humans are in the appropriate, part of the journey, especially when it's the caring or, doing the understanding the needs of the individual, but really still having digital there to help. Both sides matter and both can create a real impact when done well. So while bottom-up innovation is always exciting, it may not always be exciting, but actually it really counts. When we make it part of our everyday thinking, innovation quickly adds up to just being as valuable and as big and disruptive in the work we do. Its power is that we can do it in whatever role we're in. And some of the most meaningful change comes from looking at the work right in front of us and asking ourselves, where can I do this differently? Can I reduce some handoffs? Are there, things that I don't need to do? So remove duplication, or what can I start automating? And that's where potentially the AI comes in, because you might get it to assist you in doing some of this. I challenge my own people to start with one task and ask themselves, do they really need to be doing this? Are we doing it because it's what we've always done? Or if we need to do this task, how can we do it differently or a little bit better? Encouraging this kind of thinking has meant lots of little small wins, which add up to some real returns in productivity and make it easier to let go of some of the old ways and the way we've worked that don't serve us anymore. AI, as I said, is well suited for the bottom-up innovation, especially for streamlining those little administrative tasks, the research tasks, that repetitive middle stuff that you do in the middle. From a top-down perspective, innovation can be a little bit bigger and does require, some of that North Star setting. They can be a little bit more disruptive and can take us, a bit out of our comfort zone. But that takes vision and leadership and some, sometimes a little bit of investment, although as we heard from our previous tech talk, where, in Uniting, they introduced Buddy, didn't take a huge amount of investment, but, I think has saved a lot of time in the work that they do. So when we combine these elements, disruption, vision, and leadership, we see big boundaries pushing innovation. And these changes require us to reimagine how our systems work together from end to end, but it also makes us rethink the purpose and experience of how we're doing the work, in particular the processes that we works for people, and also which might mean you might need to reorientate, the way the work is being done, or might also look at the value chain of how things work end to end. Might also mean that you might need to give people some new skills as they try to move forward on something new. It's not always comfortable, but I found that the top change takes leaders who are willing to embrace the challenge and people who are would love to take on the curiosity and roll with a little bit of disruption. And I find sometimes that when we step outside our comfort zone, that's actually when we get the most benefit and joy from the work we're doing, because we tried something new and we were successful in it. So innovation in care sectors isn't new. We've been hearing a lot about it. With the rapid change of technology, we're seeing for consumers, new technologies can bring more personal and timely and connected care if done well. Technology, data, cloud and AI are all coming together to make this all very possible. AI is lifting productivity, improving care and easing workforce pressures, but it actually needs to be applied and integrated in the work we're doing. So in aged care, we've talked about things in the past where we've seen fall detection, companion robots, care planning, some of the robotics where, some of the food or the laundry is used, robots are used to, help move things around the residential aged care facility. In health, it's appearing in areas like cancer screening, in AI scribes, decision support tools, and, even in some surgeries. And new applications are emerging all the time. So as technology evolves, regulation must keep pace. Privacy needs to be considered, your data protections, medical device regulations, consumers' rights, clinical safety. So I really encourage everyone to experiment, but do it with care. Healthcare has unique requirements because errors can have serious consequences, and that's why we need a sort of national stewardship and coordinated approach is essential. Trust and safety really needs to sit at the center of whatever we're doing because it takes such a long time to build trust, but you can lose it very quickly. So that's all I have for you today on innovation. Hopefully those 2 bits of learning bites have helped. I think we're moving on to Q&A now and to answer some of your questions. So Janine, I might get you to kind of coordinate all of this for us.
Excellent. Thank you, Faye. Okay, for the rest of today's webinar, as Faye mentioned, we've got time set aside for your questions. So let's bring our panelists to stage. So Faye's here. We'll welcome back Shahara, Michelle, Annette and Apira. And we'll take the slides down perhaps so everybody can see the people on the panel. Before we start, I would like to share some information about how we prioritise your questions. So just so you've got some visibility in how we try and manage this in the room while we're taking your questions. So we focus first on the topics that we've discussed on the given day, because those people are here and they're able to respond. We know we've got the expertise in the room to answer those questions, so we try and prioritise those. We also have a range of SMEs, subject matter experts and people who are standing by in the background. So where we have people who are able to prepare answers to your questions, we also prioritise those. We obviously pay attention to the most upvoted questions. It's not an exact science. It's all very dynamic to run a session and watch the board at the same time, but we do try and get to what's popular for you. We don't really look to avoid any questions, but occasionally we'll steer clear of a question because we know we don't have a useful answer on the day. So in the spirit of transparency, I will let you know we don't have any support at home policy subject matter experts in the room today. So a bunch of those questions will need to be taken offline, and I do know that a couple of those have been really popular ones. I'll try and mention them just so you know we've seen them and that we are following those up. Okay. Pretty much based on the time we have, we'll get through as many questions as we can. So welcome panelists, nice to have you back with us. I will start by just raising a couple of the very popular questions that have been entered by Nicole. So thank you, Nicole. Obviously, your thinking is something that's resonating really well with the rest of the audience. So you had a couple of questions that were about support at home. One was capped pricing, was around capped pricing and was a question on updates related to cap pricing, particularly given that budgets need to go to boards next month. As I mentioned, we don't have the support at home SMEs with us today, but we are chasing an answer in the background. If we get a response before the close of this session today, we'll share that with you, obviously. Otherwise, we'll take this question offline. We will let the policy team know that this one has time sensitivity. And so we'll chase that with some urgency. You also had another question, which was updates on providers getting notifications that are live when clients are granted funding. So again, this is one that we'll need to take offline. If we get an answer, we'll come back to you, but otherwise we'll reach out to the relevant policy people for that. Okay, so thank you for those questions, Nicole. You also had a question about, is there anything in the pipeline surrounding assessment override of the algorithm when clients get an incorrect assessment or an assessment that's deemed incorrect? So we don't have a policy person in the room for this one, but it was something that came up at Senate estimates, and we did ask the business area for a statement on this one. So what they advised is the department is aware of the attention around the operation of the IAT, which is the assessment tool, and the supporting algorithm. The department constantly monitors the tools it uses to support the operation of the aged care system, and it really does welcome feedback, data or case studies where its stakeholders wish to provide more detail about where they perceive this may not have worked as it should. So it has asked that if you have any feedback, data or case studies, you can email those through. And the email address you want to send that to is digital services sector engagement at health.gov.au. So again, digital services sector engagement at health.gov.au. And that was another question from Nicole. So obviously something that's been quite popularly discussed at Senate estimates and in the media as well. Alrighty, on to our panelists. So Shahara, this question's for you and it's from Charlene. The question is, every time I submit outbreak data with the QFR, I ask myself, do I really need to be doing this? Could the outbreak section be removed from the QFR? What do you think?
Thanks. Thanks, Janine. That would be a policy question for the QFR team. I can take that on notice, but they have the questions that are in the QFR and the and all the different types of reporting has been developed in consultation and co-design based on specific needs from the sector and government. So I will get a better answer from the QFR team, but at this stage, it's not a decision for us.
Yeah, so presumably it was included for good reasons. Doesn't mean it can't be reconsidered and reviewed. So we'll leave that one to Shahara to follow up for us. Thank you very much for that. Okay, Faye, this is a question for you. Is there a department endorsed technical minimums or frameworks minimum guidance along the lines of the Essential 8 style guidance that external ICT suppliers and aged care providers can consistently align to for security and system management? And this question is from Richard.
Thanks, Richard, for the question. So nothing specific. We have had this question before. I think there's I give you two-part answer. One is definitely use the Essential 8, obviously, as and the PSPF as, they're what we use internally in government to, as guardrails for ourselves. So that's always a good start just to be aware of. Secondly, if you're ever going to connect to government, through to B2G, there is a conformance framework that we ask you guys to adhere to. And I would probably point to that as the best guidance that you could use to say if around security and system management. And so there are some obligations in the conformance approach, and we would consider those the minimums. Now, you may not be connecting to us, but that's okay. But if you wanted something to refer to, that's probably a good start. It's kind of a minimum of what we think is good security and system management protocols. Hopefully that helps.
Thanks,
if
Faye.
not, let us know.
Appreciated. Thank you. Okay, the next question is from Amanda, and it is the latest CHSP advice around DEX 3 rollout. Our software vendors need actual dates that this data will be required to ensure they have time to develop. At the moment indicates August 2026, but when will we actually be required to report? Do we have someone that we can take off mute and answer that from our background experts?
Yep, absolutely. Kai Trainer, Director of CHSP Compliance and Selections.
Thanks for being with us, Kai.
Very welcome. Look, we are initial advice from Services Australia is the release will happen in August, and we are waiting for them to confirm exact timing of that release. And as soon as we have an exact date, we will let you know and provide an update. But once those changes go into production, we will be expecting providers to report, and the technical specifications and guidance that we published in early March should support you to understand what's coming.
Great. Thank you very much for that. So looks like that advice that you've received previously, August, is still looking like it's on track. Okay, and we'll let you know once that's locked in. Alrighty. We've got a question from Vicky regarding an update on supported home letters, ATHM refinements. Just wanted to let you know, Vicky, we don't have a subject matter in the room for that one. We will need to check that one out for you and come back. We had a question, well, actually more of a comment from George, and it was around innovation. So Faye, I'll put this one to you and see if you've got any response. So George Majalis was saying that attending ITAC and nominating for the ITAC Awards is a good way to support innovation. And he also recommended reading George Gazzini's newsletter as a really good way to keep up. And so there's a couple of links that George has added to the Q&A panel. But Faye, any comments around staying across conferences and keeping yourself in the mix to get the latest news on innovation and tech?
So a couple of things. I think the name's George Gazounis. That's always because I'm Greek, so I could do that one. Anyway, look, absolutely. I've always said that if you want to do things differently, and I know this is easier said than done, you need to kind of free up some headspace, 10% to actually do a little bit of experimentation and try new things. Because otherwise we keep talking about doing something different, but then we get caught up in the day-to-day of how we already work. And so keeping across a conference or even just joining Tech Talk to learn something, a little learning bite, is a good way of, doing things differently. I think ITAC and nominating for awards, of course, I'm going to help amplify people's good things. And I think the awards are actually a really important part of transformations, because I think, recognizing people who have stepped outside their comfort zones and actually tried new things and they've succeeded really then gives examples for others around what they might want to try, because sometimes we think it might be a little bit too hard. But when we can see things like the awards and we celebrate successes, I think that's a great way of encouraging people. So, yep, I would back that, George. And yeah, be in it to win it. You got to have a go, guys. I personally like trying new things all the time. So I know we're all different, but anyway. Anyone else?
Yeah, it's amazing how much hearing, going to an event and hearing people talk about the different things that they're actually doing in practice is so inspiring and gives you ideas for what you might be able to try locally, maybe sometimes on a smaller scale. But yeah, it's all about testing and exploration. Okay, we've got a question from, and I hope I don't mispronounce this name, Jitendra. And I'll put this one to Annette or Michelle. You guys let me know who the right person is. But as a provider, can we seek API connection?
Oh, I can take that one, Janine. What we would recommend is that you connect with your software vendor about integrating with the current client APIs and the reporting APIs. We have information on our health page, and I'll pop the link in the chat shortly. You can go there to read what is available and then talk to your software vendor about developing and integrating with our APIs.
Great. And some providers would have in-house tech, wouldn't they? So in that instance, they would be appropriate to connect. Yeah.
Yeah, definitely.
Yeah, awesome. Okay. We've got a question from Charlene, and this one is, when will we be given flexibility to submit our QFRs in GPMS by typing in our data? Okay. When will we be given flexibility to submit our QFRs in GPMS by typing in our data, or I think they mean loading an Excel spreadsheet or loading a CSV file. So, Charlene, I think we've had this question quite a few times before, so I can probably just pull one of the answers that we've used previously, which was at the moment, a CBS template is not available for quarterly financial reporting. So for the QFR templates are available as Excel documents. So you can go to the department's webpage as non-uploadable templates, or each provider has access to an individual form, which is a .xls access through their QFRs each quarter. So I think pretty much same answer on this one, yeah, they're available to you, those CSV and Excel files, but not for uploading. Okay. The next question is from Amanda. Oh no, actually I got that one already. Let me have a look. We've got a few coming through. Bear with me, folks. So there's a question around, are quality indicators still coming into home care on the 1st of the 7th, 2026? I'm not sure that we have a subject matter expert in the room for that one. Does anybody on the panel know the answer to that question? No. Oh, sorry, Jackie, we'll have to take that one offline and get the answer for you and come back to a future session. We have a question from Gillian around, are you able to disclose the names of vendors you have engaged with? And I think this is for Annette or Michelle. Yeah, so in your work, are you able to tell the folks which vendors you've actually engaged with?
Look, I'd have to take that on notice. We would have to go back to them to see if they were comfortable with us sharing their names, but we did quite extensive engagement, both through human-centered design and surveys, and we had really good responses. And our next round of engagement, I think we have 14 providers and 12 software developers that we're engaging with next week. So it's definitely something we can ask in our co-design sessions and bring back to this group when we play back our findings.
Great, thanks for that. Okay, we also have a question from Gillian around the slide deck for today's presentation. So you apparently missed the beginning of the presentation. Absolutely, the slide deck will be available. We'll post that online after today's event. The other thing is that the video also gets posted onto the health website and onto YouTube. So if you want to go back and watch the whole thing from the beginning, you can definitely do that, Gillian. Thanks for the question. Okay, Regan says we're seeing an increasing number of requests to submit data to the department via the data portal, which is a clunky portal to gain access to. What is the future of this portal? Should we be ramping up our internal management activities to support this new portal? Faye, is that something you're able to touch on?
Not sure. I think I need to take that one away and just have a look at, that one. And then at the moment, I think we've got, it's that time of year at the moment where we're going through a budget cycle. So looking at what our priorities are going to be for the, ongoing financial year, and then look at where maybe the data portal fits in with all of that. So, guess watch this space, but thanks for the feedback. And then we can at least, by knowing the feedback, as we start to do our thinking and planning ahead, we can definitely make sure that, the hotspots that you guys are providing us feedback on are considerations in our design work and our planning work.
Thank you. And I guess that's just a good reminder that if people do have suggestions about improvements or issues that cause you grief, make your job harder to do, make reporting more difficult, definitely do let us know. It doesn't mean for sure that we'll be able to fix it quickly, but it does mean we can get it onto the backlog of things for improvement, and it can be considered as part of budget cycles, etc. So thanks for that, Regan. Appreciate the suggestion. Okay, next question is from Marvin, and I think this might be an Annette or Michelle question. At this stage, the B2G developer portal, the question is, we will have access to SEERS data through this API, and I'm thinking that's talking about the B2G elements. So SEERS, serious incident records, I think that is.
Reporting.
Yeah, I
Reporting
will
Use
just,
system.
reporting.
Yeah.
yeah, I'll just clarify that these APIs don't expose the CERS at this point in time. So this is often raised in these and other forums. So it is definitely in our backlog roadmap as an API that we would like to develop, and but it's not currently available. So when we release these APIs, we do come to sector partners and tech talks. So I would encourage you to continue coming along to these forums for future announcements.
Great, thank you, Annette. Okay, this question is from Vicky, and I think it's for Shahara. Is the QFR not uploaded template always the same when we're in the QFR GPMS? So the QFR uploaded template, I think they're trying to say, isn't always the same when we're in QFR GPMS. I had always downloaded it from QFR GPMS while doing it in case the upload does not work or if there are minor changes. Shahara, does that make sense to you? I'm wondering if someone who's across QFR will be able to.
No, I
Yep.
can have a crack at it, and if this is not
Yeah,
the
great.
question, then I can take it to QFR. Assuming the question is about the uploadable template not being the same sometimes. If that's the case, it would be updated based on policy changes that would have been communicated to the sector, along with changes and updates to the QFR. So if additional data items are added or removed or something like that, through consultation with the sector and co-design, the template would reflect that change and therefore would be updated to reflect that change. If that is the question, then that answer is what it is. If it's a different question, I'm happy to take it on notice.
Great.
I think.
All right.
I think.
Sorry,
I think
jumping in.
Shahara. I think I heard that sometimes the fields that they're filling in the screen doesn't match the upload spreadsheet, and so she'll download it from there to get the latest. I think we might just take it away and make sure that those things are always in sync. I think that's what I kind of understood it to be. Anyway, that's cool. Technically speaking, you should be able to either fill it in through the screen or fill in the spreadsheet and upload it, and they should be the same. And if they're not, kind of let us know, because it might be a defect, guys. Thank you.
All right, thanks, Vicky. And if we've misunderstood that question, feel free to drop something else in to steer us. Great. We have a question from Nigel around the closing the gap agreement. And that one, Nigel, thanks for the question. Appreciated. We don't have a subject matter expert in the room, so we will take that one on notice, but just wanted to acknowledge and thank you for the question. There was also a question from Richard around, first of all, a thank you for the confirmation of the technical guidelines, very helpful. Good to hear, Richard. Pleased about that. Richard asked if there was a link to the conformance documentation guidelines that we mentioned. Just so everybody knows, we have responded to that question in the Q&A panel and added a link. So there is a conformance page on the developer portal that has information with additional profiles being released soon. If you are keen to get the answer to Richard's question and find that link to the conformance page, just go into Richard's question on the Q&A panel and that will be a response under that question. Thanks very much for that one. Okay, and then we have another question from Vicky, and this I think again is for Shahara. So care minutes in the QFR is based on roles performed. No payroll system would record roles performed, and we would need to go back to the rostering system. However, the rostering system may not have all of the EBA award payments made like payroll system does. Amalgamating the two systems for this reporting is definitely time consuming and manual. So that's obviously a comment just about some of the complexity in recording the care minutes. Shahara, is this something you've heard before?
We've definitely heard about the complexity and administrative burden, and definitely appreciate the what providers have to look at to provide additional information, and there are mechanisms in place where things are being reviewed and considered. Not specifically in relation to this comment, but obviously we're as a government looking at things in a broader policy sense.
Yeah. I know one of the things we talk about quite a lot in sector partners is how do we streamline reporting, and how do we, obviously part of that is about design and what's being asked for, but then a part of it is also about the digital solutions we can develop that help us exchange information more easily and pull from different systems, and the APIs are a really important part of that work as well. Okay, I'm just looking through the questions, and it does appear that all of the other questions we have are ones that we need to take on notice. So just to sort of quickly acknowledge those, there's a question from Nicole around streamlining double and triple entering of client data in departmental systems. Again, that sort of speaks to what we were just discussing with Shahara as well. There was a question from Charlene about the reporting review and looking at reducing the data collection, sort of speaks to the same issue again. There was a question about the outbreak data in QFR. I think we answered that one. There was also a question about whether the department is working with IHACPA on the APIs. And there was a question about support at home quarterly budgets. So those questions, I'm afraid we're going to have to take on notice today because we don't have the answers available for you in the room. We also had a question about the ATHM approval notifications needed for providers, and that one we're also taking on notice. And I think that basically brings us up to date for the questions, unless I've missed anything. Matt, do you want to jump on and let me know if there's anything there I've missed?
No, I think we're well covered. Janine, you have a last minute comment from Charlene, if you haven't picked that one up, just about QFR.
Yeah, jump in.
Oh, well, the question.
I don't have it, but go on.
Look, possibly more of a comment to say that the QFR is definitely not streamlined. So possibly more of a comment than a question there.
Yeah. Okay.
I think that's all we have for today.
Great.
Excellent.
All right. Well, that's a first.
We might wrap
We
up.
got through all of our questions. For those ones that we'll take on notice, we will come back. Matt, I think at the next Tech Talk, it would be worth us doing a bit of a replay of some of the popular themes that have come out of this one, given that we've got quite a few questions that we've had to take on notice. So we'll go ahead and do that. Thank you to our panelists and presenters today. So Annette, Michelle, Shahara and Apira, I appreciate you guys sitting on the panel and also sharing information with us today. We'll package up those questions for you so you can take them back to your relevant areas and use them in the next phases of your work. Thank you guys for bringing the slides back up on screen as well. Appreciate your questions and the discussion. And I will hand over to Faye to take us out for today. Thanks, Faye.
Thanks, Janine. And as always, we'd love to hear your thoughts. So any in our post-event survey. So please take the time, if you can, to fill that in. When our upcoming webinars are open for registration, they'll be on our websites at the top of the page, where you can also watch all of our previous webinars. So you can use the QR code on your screen or the links from the chat. I'd like to thank the engagement team who feverishly work in the background to make these events happen. So thanks very much, everyone. And to our speakers who come and join us here today, and Janine for being a fabulous host. And for everyone who's taken the time to come along in the audience, thank you so much for all you've done to drive digital transformation for aged care. Together we've been pretty brave and bold, and together we're moving the dial on digital maturity and making it happen. So thank you very much, and we'll see you next time. Bye for now.